Thank you, everyone. Thank you for joining our webinar here. We've got a great speaker lined up for you today. Ariana, who's speaking to us from Northern Health. It is very, very gracious of her to be presenting to us because she's got a great story, but also very gracious of her to be presenting because it is very early for her where she is in Melbourne.
Correct.
As people file in here, I just wanted to take an opportunity to remind everyone that we are recording the webinar today, so it is possible to share what we learn here with others afterwards. Ariana is also making these slides available, so you'll have those. And we all are going to have time for a Q&A at the end, so when the time comes, I'll be monitoring the chat and the little Q&A module there at the bottom of your screen. I'd be happy to answer any questions that you might have. So without further delay, I'll hands off to you, Ariana. Thank you so much for meeting us so early in the morning.
Thank you, Jessica, and good afternoon to everyone who's in the Northern Hemisphere. As Jessica said, it is a very early 6 a.m. for me today here in Melbourne. My name's Ariana Caritas, and I use she, her pronouns, and I'm a project manager at Northern Health, which is in Victoria in Australia. In the spirit of reconciliation, the Northern Health acknowledges the traditional custodians of the country throughout Australia and their connections to land, sea and community. We pay our respects to the elders past, present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. So I have the pleasure of presenting to you guys today about, I guess, the rollercoaster of improvement, innovation and healthcare. I'm going to give you a little bit of a background about Northern Health for those of you who don't even know where we are or what we do at Northern. So here's, I guess, our care at a glance, as per our most updated annual report. We're a key provider of public health care in Melbourne's northern region and one of the fastest growing communities in Australia. We take care of our community by providing a wide range of health services at Northern Health, Epping, Broadmeadows Hospital, Bundoora Centre and Craigieburn Centre. So we have 4 campuses in the northern suburbs and 1 emergency department. We collaborate with our partners to expand the range of healthcare services offered to a culturally rich and diverse community, including emergency intensive care, acute medical, surgical and maternity services, subacute palliative care and aged care, specialist clinics and community-based services. We are the busiest emergency department in Victoria, and I believe we're in the top 5 in Australia as well. It's always a bit of an argument about who's number 1. We're also in a very rapidly growing area in the northern suburbs. So it's really driving us to think differently for the needs of the population, which we have some of the highest rates of unemployment, the high number of non-English speaking patients. We have high levels of domestic violence, of drug addiction, so a very low socioeconomic sort of a cohort, but also coupled with a whole lot of new families that are, if you think about, so if you know where Melbourne is, Melbourne's sort of at the bottom, we're in the northern suburbs, so everything sort of above us, a lot of these sort of housing estates for lots of young families are also moving to as well. Even joking, and I haven't put this in here just because I'm talking to a lot of people from the Northern Hemisphere, we literally have kangaroos that bounce around our campus. So I used to work more sort of in the city of Melbourne, and I definitely knew I was sort of in the country when kangaroos literally bounced past us one day on one of my walks. So Northern Health began a journey to becoming a highly reliable organisation back in 2017. And this is a framework that's pulled from industries like aviation. We originally worked with Johns Hopkins in the States to use their learnings around becoming a highly reliable organisation in healthcare. And if becoming a HRO is our high-level framework, this is kind of this is our trusted care triangle, and this is the vehicle in which we arrive there. So we have a process view of healthcare, which is the circle around the outside, which is coming in, getting better, going home and staying well, and everything that we do should fit into that. We have our Northern Health values around the triangle, safe, kind and together. And then we've broken down into trusted care elements. So all of the pieces of work that we do to achieve becoming a HRO should fit into one of these elements here. But what I'm actually here today to talk to you about is our Ideas Lab and the exciting things that we are doing at Northern Health. So I am fortunate enough to run and manage a Ideas Lab at Northern Health. It was established in March of 2018 after our CEO, who we're very lucky is a very innovative and different thinker, had seen similar spaces in other industries, and at Canterbury Health in New Zealand, they're doing some really amazing work in this space as well, if you guys have heard of them. The really important thing, so we got a dedicated space. So originally when we started scoping this up, we were going to be doing it in a meeting room and having to pack it up and putting it down. And Siva actually decided that he wanted to do a dedicated space for our innovation space. It's away from the hospital. It's in our education building. So there's something very powerful about staff when they have to physically walk away from the hospital to go into a dedicated space that has power to it. So this is our picture of our beautiful space. It's also built in the shell of our education building. So you have to actually walk through a shell, kind of construction zone before you get in there, which again, I think adds to the power of the space. I love when people come here, particularly clinicians, and they say things like, oh, it's not finished, or it looks like a kindergarten. Because in my mind, that's exactly what we're supposed to be going for. I want them thinking differently and not like they usually would in their kind of clinical setting. How did I manage this space? Right time, right place, dumb luck, I think. I've never managed a space like this before. I was there and our CEO said, do you want to look after this space? I was good at facilitating meetings. That doesn't necessarily mean that you're good at running an innovation space, but I have a bit of an attitude of, sure, why not? Let's give it a go. What's the worst that can happen? I did a lot of Googling. I did a lot of connecting with other people within this community. Lots of buying of coffees for people, hoping that they'll give me some of their time so that I can learn from others within this space, and a lot of learning as I go. What we soon realised within the first year of having our space that having a physical space is amazing, but you have then limited reach. So we purchased IdeaScale in May of 2019 as a way to reach, as I said before, we've got 4 campuses. And obviously working in a healthcare setting, clinicians who work across multiple shifts and night shifts and different campuses. So we really wanted to be able to reach all staff across the entire organisation. So I think, again, it was number one of those, my boss said, so you can work out this IdeaScale platform, can't you? And I was like, again, sure, why not? How hard can it be? I guess I didn't really realise that I would have to be sort of creating the campaigns myself. So that was a nice learning curve that now I can create campaigns pretty quickly. It's like second nature, but another one of those, sure, I'll give it a go. How hard can it be moments? I do think the challenge for me in this space is that whilst I sit within a project management team, I'm the only person who runs the space and runs the platform. So I'm always very jealous when I hear of, when I've listened to other webinars of other people who have teams of 2 or 3 or 4 or 5 or 7. It's just little old me. So I feel like sometimes I have lots of ideas and only so many hours in a day. So that sometimes can be the bit of a challenge to me. Before I really talk about kind of, I guess, last year and this year, I think it's really important to talk to you all about where Northern Health has come from to kind of really give you a sense of how far we've come. So back in 2016, Northern Health was actually on Performance Watch. And in Victoria, that means, so we have a set of KPIs that we're responsible to meeting for the government, and we weren't meeting a lot of them. And that means that you have the Department of Health meeting with you monthly to watch your performance. So that meant that our previous CEO was given the axe, and so was most of our board. Siva came in, who's our current CEO, and he was only supposed to be a caretaker for 3 months. He was supposed to be coming in to fix up our finances and then go. And just before he arrived, because our performance in terms of financials was so terrible, there was redundancies happening all around the organisation. So you'd go to send someone an email and then you would get the disabled email back to you. Our team specifically, I went from like a process improvement team with a dedicated director and 7 staff to the director going, half the staff going and being merged into another team. I feel as though I survived, again, mostly to do with dumb luck. I'd been at the organisation the longest, so I was one of the more expensive ones to get rid of if they were going to be going down that path. Senior leaders understandably were throwing each other under the bus. There was a lot of protecting their own turf and protecting their own skin. And I guess the really interesting thing was Siva really started to change this. So I think this space and giving staff a place where their voice was not only heard but welcomed and was the catalyst for change was really important. We started empowering staff to make problems and make mistakes. So previously, we were in an organisation that if you made a mistake, you got fired. And so people just stopped admitting to any sort of errors in their area. And one of Siva's philosophies is around, if we're going to fail, let's fail fast so we can learn from that and move on to the next thing. I think it was really important that we saw a lot of happiness and joy and laughter coming again from the organisation. A really good example of this is one of the first ideas labs that I ran was on dirty dunnies. A dunny in Australia is slang for toilet, for those of you who don't know. So yes, I ran a ideas lab on dirty toilets. It was really about the feedback that we'd received from patients around cleanliness of bathrooms, but our promotion out to the organisation said dirty dunnies. And people, that would never have happened before Siva came. So we hit 2020. The year that was, and is still continuing on and, probably will for quite a long time. In Australia, obviously, we've had a very different experience to the rest of the world and in a lot of ways have been just incredibly lucky. At the beginning of 2020, we watched what was happening in the rest of the world and we started panicking/planning, depending on how you want to frame it. We were waiting for the tsunami to hit like we were seeing around the rest of the world. All of my work stopped. It was all hands on deck. I lost my beautiful ideas lab to offices so that social distancing to occur. There was a lot of pretend tears occurring around that time, and change was happening so quickly within the organisation. In between our wave 1 and 2, Siva sat down with me and said that he had seen so much rapid improvement happening and wanted to leverage off this momentum to create new models of care. We met for an in-person workshop. So this is probably mid last year. And I ran a workshop in a mask, which for those of you who facilitate workshops, the first time I did one in a mask was a very interesting experience. And put the challenge to the senior leadership team around creating new virtual models of care in light of the global pandemic that we were all experiencing. Do you know what the leadership team response was? Our community don't have access to technology. So if you remember what I said to you before about, really being a low socioeconomic sort of group, the whole senior leadership team believed we couldn't do any of this because they had no technology. I didn't think that this was true. So I asked our chief operating officer if I could actually ask our patients, because this is a myth that I've heard since I've been at Northern Health. Well, we can't do virtual, we can't do digital because our patients are too poor and too illiterate to have technology. So I, with a small group of nurses, over a week, and we only had a week to prepare, ran a survey where we actually asked our community so we had 15 questions. So we ended up asking 865 members of our community 2 high-level questions around how they were going at home during COVID and thoughts on virtual care. And again, remember, these answers were before we hit our second wave, which was actually much bigger than our first wave, nothing like the numbers that you guys are seeing, but much bigger. And these were the results that they talked about. So 83% had some form of technology at home that they could use video conferencing on to do telehealth with. 24% had avoided going to their GP, and this was just in the first half of the year. And for non-urgent care, 26% said they would prefer to come to Northern Health, 32% wanted a video call, and 42% wanted a phone call. And 13% had also reported that their health had declined. So we went back to the senior leadership team and said, well, here's from the patient's mouth. Now can we create some virtual models of care? So we did, and we used, because we wanted to do things so quickly and hearing about a second wave that was coming, we used a sprint methodology to set up new models of care that are based by the senior leadership team. One of the projects that I'm most proud of at Northern Health is that we actually established a virtual emergency department. So this is our flyer for the virtual emergency department, and this is a Aboriginal and Torres Strait Islander specific flyer for our community of Aboriginal and Torres Strait Islanders. This is literally a virtual emergency department where you can be sitting at your home. You can register your details through a QR code or through our website. You go into a virtual waiting room, and then you're also able to see a triage nurse who uses validated software to triage you virtually, and then you get sort of seen by a virtual doctor as well. The amazing thing about this program, this has been running since October 1st last year. Since we implemented this program, and we run it between 1:30 and 9:30, 7 days a week, 70% of patients who present using a virtual ED are able to be managed within their home and kept outside of the hospital walls. So interestingly, we first set this up as a sort of a way to manage social distancing within the waiting room, but also hearing that patients were staying at home and not presenting to the emergency department. But since we've kind of gone back to pre-COVID presentation numbers, this is a really good way for us to manage diversions in a true diversion program. So I've worked in process improvement and improvement in the emergency department, and we quite a lot. And we always talk about diversion models. This to me is the first true diversion model that I've ever seen within the healthcare system. I don't think this virtual emergency department would have been possible if we hadn't set the foundation of creating a culture of innovation and thinking differently at Northern Health with the Ideas Lab, with using IdeaScale. And of course, a pandemic doesn't hurt in terms of getting people to think quickly and think really differently. On top of all of this, last year I also was seconded over to our Department of Health to help with the task force in improving the contact tracing team. So that was, I was trying to set up this virtual emergency department as well as on a task force over at the Department of Health as well. So busy year as it is for so many people. So this year, 2021, we are incredibly lucky here in Australia. We are pretty much back to normal. We have 0 community cases, and so I guess what does that look like then for us in reflections of last year, and what are we going to be? How can we learn from the amazing things that we did last year? So I got my Ideas Lab back, which I never thought would happen. Usually in healthcare, if you lose a physical space, you never get it back, particularly to offices. But I got it back. It's again, I think that shows how much our CEO really values this sort of space and creating this space for people. We're running our second lot of sprints. So we're taking the methodology and the learnings from last year, and we're running a program this year called Ideas for Innovation. But we're opening up to the entire organisation. So we're going to use the same short, sharp methodology, but take all of the learnings that we from last year. We're going to also run, I run a sort of a HRO champions network, which are sort of frontline staff who want to improve healthcare. And they've come up with an idea of 27 ideas in 27 weeks, which is about really those small, annoying things that bother you as a staff member and make your day, make waste in your day, but are really quite actually easy to solve, but you may not know the right person to talk to or how to go about doing that. So a really good example of that is Zoom is actually forbidden from our work computers, but you can actually get it if you say that you need it for work purposes. And so our whole entire research team all use Zoom to connect to our university partners. And so we were able to solve that and say you're actually allowed to have it, because when at the beginning of last year, there's a lot of sort of historical, well, at the beginning of last year, we weren't allowed to have it, so we've never asked again. And I'm also trying to work through the virtual face-to-face workshop, so a hybrid model. It's not perfect, but again, a bit of my attitude is always, we'll just give it a go, and it's, we'll learn as we go. So what have I learnt? It's been a wild ride. When all of my work stopped at the beginning of last year, I lost the Ideas Lab. I personally realized how much of my identity was tied to my job. I felt very lost not knowing what I was going to be working on. We did some amazing work last year. This pandemic has been awful, but in some ways, I think it's been the kick up the butt that healthcare, at least in Victoria, needed. We switched on virtual meetings overnight. Previously to that, we had no virtual meetings. Having a supportive CEO who encourages thinking differently is absolutely everything. There's an incredible community of people out there like me that I can learn from, and connecting through IdeaScale has definitely ensured that I have people I can talk to and bounce ideas off. There are some days where the imposter syndrome is real, not feeling like I'm an expert in this space, but wanting to give things a go, being on my own, not necessarily having the sophisticated frameworks that other organizations have. So the imposter syndrome is definitely real some days. As someone who leads the innovation program, I have to respond rapidly to what the organization needs. So I've asked to set up can we talk to our community and run a survey? Yeah, sure. Okay, you've got nurses next week. Off you go. Oh, okay, sure. I'm not going to say, oh, no, sorry, I can have a few more weeks of planning. I take an opportunity when it's presented to me. Working in this space is a privilege. I pinch myself every day that this is even my job. And I think last year taught me that working in healthcare is really a privilege as well. Northern Health specifically had some of the highest number of COVID inpatients in Victoria, and seeing how our organisation came together really made me proud to work at Northern Health. And a few years ago, if you were at a party and you told people that you worked at Northern Health, you just didn't do that because people would give you such a hard time about it. And my final thing is I'm only allowed to have fake plants in our Ideas Lab now, because when I bought real ones, I killed them all. And so I'm only allowed to have fake plants now. I really appreciate you guys checking in with me today and listening to my presentation. I'm happy to open up to questions, and my contact details are at the bottom there. So feel free to email me or connect with me on LinkedIn. Would love to connect with some of you guys.
Thank you so much, Ariana. I also kill plants, but the good news is I heard that even having fake plants still has some of the same health benefits to have them in a room. So
good to know.
At least have those. I really loved your presentation. I felt like you shared a lot of the best practices that we are telling people to do all the time, like the fact that you had your values wheel that sort of shapes some of the stuff that you're working on, the fact that you've got a bought-in CEO who's a senior leader who is helping you to take away obstacles. The virtual emergency department is such a cool outcome. I am so impressed that you guys were able to do that. And lots of great other things, like culture being the first step to being able to deliver on ideas, changing that first. We've got some questions coming in. So I thought one of the things that you said that I really liked was that you like that it looks like sort of like an unfinished space, your in-person lab or a kindergarten classroom. So with that in mind, what do you think it is important to have in an innovation lab, ideas space type of thing?
So I think that unfinishedness, I think the allowing people to play. So I have boxes of confession time, my husband's Lego, which he still had from a child, that I had to pry from his hands to take into the space. Play-Doh pre-COVID, obviously. It's important that it doesn't feel clinical from a clinical point of view. I think the fact that people walk in and they're a bit jarred is good. I'm quite a tidy person, so my boss is always telling me to make it messier. He doesn't like how tidy it is. So, and I think also examples of ideas that have happened previously. Our space, you physically move through the space as well, which I think is really important. We don't have any chairs like with backs in there, so that people can't just sort of sit back and get comfortable. We have the kind of little stools and things like that. Although that did backfire once because we had consumers in a workshop who needed a proper chair, so I had to quickly scramble and get a chair. Again, these are all the things that you learn as you go. But it's about getting up and moving to the next space, and now you're moving in here so that you're not stagnant in your body, therefore not stagnant in your thoughts.
That makes sense too. Is there anything you say I said what is included, but what is anything that it shouldn't be included too?
I learn as I go don't put real plants in if you can't keep them alive. It's probably the main one.
Yeah, that's probably a bummer to look at dead plants. I do think that it's really amazing that you got your Ideas Lab back. It's not unique, obviously. If you lose a space in almost any industry, it's hard to get it back, but they did. So what do you think it was, what value was there that made people realize that you needed to have that space back?
I did a lot of nagging about it last year as well. So I think I hope that helped. I think Siva just really, I think the fact that he reinstated it shows that he sees value in the space, and that the ideas that come out of there, and that it's a protected space. So, I say to people, I'm a little bit of a door bitch when it comes to the Ideas Lab. You can't use it for a normal meeting. It has to be a workspace. And it's really getting this sort of reputation around the organisation as this dedicated space to think differently. And, and as a result, we've set up a virtual emergency department, which is the first of its kind in Australia. So I think that the proof is in the pudding of, and we've always been historically, Northern Health wasn't a health service that attracted a lot of funding. We were kind of a small community hospital that is now exploding at the edges. So we've had to think, and sometimes not having money means you have to think differently. I've got a friend who works at the Children's Hospital, and they get so much money thrown at them. And he was saying, and he works in a very similar space, that money doesn't necessarily solve everything. Sometimes an electronic something if you're not engaged with it or you don't believe in what you're doing, doesn't necessarily solve everything. So we've had to be innovative because we have no money. And I think by the fact that there's been so many amazing ideas come out of there and be implemented is why he thought it was important to have back.
I also loved your idea of starting with the Dunnies campaign as like a very it's playful enough, and also everybody has that experience to speak from. It's a really great way to start. Anything surprising come out of that particular campaign?
I think it's I allow people to think as creatively, because I think, I don't do the limited thinking, and then, you can come back from that. So we had ideas that were like, they would be like robot toilets that would clean themselves, and it was too far. But then I think you can draw ideas back from that as well. So allowing people to have that kind of really creative space. That was one of our first workshops. So that was many years ago. We're going through accreditation at the moment, which is you have to be accredited every 4 years and you meet a whole lot of standards. And one of our issues coming up again is cleanliness. And I actually said to my boss, I hope I'm not going to be having to do like a Dirty Dunnies 2.0 workshop. So watch this space. I may end up having to do another one.
We have a great question here about getting through 2020 and being as adaptive as you were. How did you manage your personal resilience doing 2 jobs? And how does that resilience support your innovation efforts?
Great question. There were definitely lots of sitting on the couch, eating lots of food days. I don't think I felt resilient the whole year when all of my work stopped. And I'm not a clinician by background as well. So, and there was this bizarre energy, scary energy working in a health service, seeing what was happening in the rest of the world and planning for this tsunami that we were expecting. And I was part of the planning team, and, seeing documents that are like, who the kind of wartime triaging, who are the patients that we would see and who are the patients that we would say, sorry, you don't get a bed. Like, that's really quite intense stuff to be part of. I have always been really passionate about making a difference for patients and particularly for our community. I live in the Northern Health Catchment. A lot of my family lives in the Northern Health Catchment. And I've always been really passionate about being able to provide care to disadvantaged communities. Being able to sink my teeth in and start talking to patients and doing work helped with my resilience. That passion drives me. So, setting up a virtual emergency department is like the best thing I've ever done in my entire career. So that just motivates you and gives you something to focus on. I think when you're at home and all you're reading is COVID numbers and COVID cases and things like that, it's really overwhelming. It was really good it was a massive honor in terms of working at the Department of Health. I spent the first 3 days walking around because Victoria had, we were in probably my understanding is it's some of the most sort of intense lockdowns from around the world, in Melbourne in particular. Mm-hmm. So couldn't travel further than 5Ks. We had permits to leave the house. Curfews weren't allowed after 9 p.m. So I did spend the first 3 days walking around going, no wonder we're stuffed, no wonder we're stuffed. There was a much more expletive word in there, but I won't. but then it's nice to be part of the solution. So get your hands in, and I believe in this stuff. I'm very passionate about healthcare. I'm very passionate about what I do, and so the resilience is easy when you are doing something that aligns with your core values.
Makes a lot of sense that a lot of workplaces it's about finding employees who really want to be part of the purpose. It's like the opposite of doom scrolling to do something like create your virtual emergency department, which we did have a question about as well. What software or web-based platform do you run the virtual ED on?
Yeah, so we've patched it together again off the smell of an oily rag. So we use a software called RedCap for our registration, which is actually a research software, but we use that because it's free. We then use Health Direct as our telehealth platform. And again, that was because at the beginning of COVID, the Victorian government made it free to all health services and pushed it out. So that's the platform that we use for the telehealth component. And then we use a software called Odyssey, that's your validated triage software. So that originates in the UK, and they have they talk very proudly about having like 100,000 presentations without any clinical incidents or something like that. Don't quote me on the number. Our Ambulance Victoria also used Odyssey, so we knew that it was a software that was used within Victoria. But our Ambulance Victoria use only phone calls. So you imagine if you call an ambulance, it's not a video call. So it's a validated software even if you're using phone, but then we add the additional layer of risk mitigation by using video to be able to see the patient and see what's going on with them. So we had to fit in with the stuff that we had at home. At work, we contacted, I think, one of the Xerox or something like that, met with us to talk about how they could integrate virtual ED into our folders, and they quoted us something like, I don't know, 200,000 Australian dollars, which Lauren, who's my clinical lead on the project, and I just looked at each other and said, this person realizes that we work in public health, right? There's like zero money. So it was one of those like poker face conversations. Don't balk at how much money that was. So those are the platforms that we use.
We had a question to hear about how you're marketing these programs internally, like telling people that they have these tools. Do you find stakeholders come to you asking to use the physical and virtual space, or are you reaching out to them to do it?
A bit of both. I have become the face of the Ideas Lab, whether that's a good thing, bad thing, otherwise, I'm not sure. So I have a lot of people approaching me to either just use the space because they know that I'm the door bitch, but also to help facilitate. So I've become kind of like the organizational facilitator of the space. So I always say, do you want just a space, or do you need me to assist you as well? It's one of those always working in progress, and emails are, not a good way to engage, particularly clinicians and frontline clinicians. It's a problem that I think about all the time. Hetero Champions Network have been really good at kind of being a network. So I always think about them. I don't know if anyone's Sherlock Holmes fans with the network of the homeless. I don't know what he calls them. But, it's like, if I tell you and you tell 6 people and 6 people tell 6 people, that's what I hope with the Champions Network. It's not quite at Sherlock Holmes level, but that's what we're trying to do with them. And Teams has been a really good way as well. So I'm working through now what setting up some like org-wide channels can look like, so that we can push notifications to people's phones but that's you got to work through the logistics of that in terms of governance and so that people don't feel it becomes white noise when they're getting a whole lot of messages. So if anyone has any better answers or better suggestions, always open to it, because it's one of the things that I think about a lot.
Yeah, I think you're right too about building that champions network advocates who are helping you spread the word is one of the most powerful ways too. Somebody was asking too that you mentioned talking to somebody at Children's Hospital, but what other things do you do in regards to collaboration? Like, do you ever work with startups or talk to people at universities? And they also asked what's on the horizon, but we'll ask that second.
I'll talk to anyone who'll listen. So lots of partners. So I am only where I am today because of the kindness of people who were willing to give me their time. So I connect with lots of I'm very well connected around other health services. So I'm the Northern Health Improvement and Innovation Advisor rep for our Department of Health kind of quality department. So it's called Safer Care Victoria. And so I'm part of a network of similar people across every health service in Victoria. Just because of my background, I did a kind of a graduate program in like health leadership. And so I've got friends across all the different health services. I'm connected to universities as well. There's been a couple of amazing guys who've helped us with the virtual ED project in terms of doing some research on it. And then, it's all like, I know someone who knows someone. There's a couple of other kind of innovation spaces here within Victoria that pre-COVID I was connecting with as well to learn from them. And I think I just do the cold calling, right? So, if you see someone interesting on a webinar, I'll just be like, hey, you're interesting. Do you have 5 minutes to chat with me? Doesn't always work, but, it doesn't hurt to send an email. So I like to joke that stalking is indefinitely in my position description, that's for sure.
I think so. And I meant to say, too, that I love that your attitude is why not? I think that's such a superpower in the innovation space, is starting from that place instead of the, I don't know, what's feasible. You're just starting from the why not place.
Thank you.
I'm going to ask the other question that came up, which was, what was the difference of conducting a workshop in a mask?
Oh, it's just you can't breathe, and I can't see facial expressions. So I'm, if you haven't noticed, quite a loud person. And so so I facilitate well. I can facilitate a group of 100 people with no problem, and they can hear my voice. So, but projecting your voice means that you're exerting oxygen, and then the mask is coming back and being sucked back into your face. So it's a whole thing. But it's the facial expression. So I'm really good at reading cues and who are the people. I mean, obviously you can still see eyes, but you're missing the little smirks or the kind of those things that, and it's by the same token, the virtual space, which is if I'm running a workshop virtually, I ask everyone to have their camera on so that number one, I know that they're not online shopping, but two, so that I can see how they're engaged. And you don't have that body language energy that I'm used to feeding off, but at least you can still facial expressions. But then with masks, it's, they could be doing a little like smirk underneath their mask and you don't know. So it was just, I think 2020 was just a whole year of, oh, okay, this is interesting and different. All right, this is what we're doing now. So that was just one of many.
Yeah, we totally didn't realize some of the things that we took for granted until they were taken away.
For sure.
Well, then I think a great question to end on was the question that was part of that other one, which is what's on the horizon for you guys? There's 27 ideas in 27 weeks. I love that one too. Great way to build momentum that way too.
Yeah, and so going out to the entire organisation to do the kind of Sprints 2.0, I'm really excited about. I'm really excited to get some ideas from frontline staff in terms of rapid improvement. And I love building capability of frontline staff. And, I think so often, particularly clinicians, think that project management or innovation or change or improvement is out of their reach. And, I like to say that if you can organise a kid's birthday party or you can organise a wedding, you can organise a project in healthcare. It's,
so
much of the same sort of kind of concept. So I'm really excited about hopefully getting some gems from our frontline staff and being able to kind of grow them and educate them. And we're going to put a lot more structure in this year. Last year, again, it was a bit of a throw it all together, kind of fumble our way through. So we've taken a lot of learnings from last year. We're going to provide them sort of weekly education on different topics like project management, quality improvement, business case writing, and depending on what the topics are, we'll create some education for them, understanding the system, how it all connects. We're expanding virtual ED. So, it was a real proof of concept when we started. How do we know it's even going to go well or people are going to use it? And so now the funny thing is our Department of Health don't know how to fund it because it's a brand new way of doing care. So again, very lucky, Civa has just self-funded it. And as you can imagine, it's not a cheap program, but we then have to show that the numbers can be consistent. So we've kind of morphed that a little bit. So we've got some virtual booths within our emergency department so that if on the peaks and troughs within virtual, we can pull from our actual waiting room to alleviate waiting room pressure. And looking to connect with a lot of partners. So I've actually got a meeting today with our Ambulance Victoria to have a conversation with them about how they could be using virtual ED in a patient's home so that they don't have to come into the emergency department and be ramped waiting to come into the emergency department. So lots of exciting things. I think 2021 is going to be really exciting. And lots of again, really cool stuff, and feeling very privileged to be where we are in Australia with things, I guess, being new normal, but as close to normal as they probably will be for the foreseeable future.
Well, that is a lot of stuff to be excited about, and I really appreciate you getting up early and starting your day by sharing your story.
I had an enormous cup of coffee beforehand.
Yes. Good way to start for sure. And have a good rest of your day ahead. Hopefully we get to meet in person one of these days at a future Open Nation, share these stories in person again.
That would be amazing. Thank you all for coming and listening to me. I really appreciate it.
Have a great day, everyone. Thank you, Ariana.
Bye.